So we're AESOP technology. AESOP stands for AI Enhanced Solutions for Physicians, and we build clinical deep reasoning AI built on more than 3.2 billion patient visits of data, including from the Mayo Clinic platform. And it's a big deal, healthcare AI, not just right now, but going back decades, there's been a lot of hype all the way back to IBM Watson. Today we have LLMs like ChatGPT, Google's working on it, everybody's working on it. But the reality is, in practice, it's had pretty limited impact. And the reason is because the good AI, it's good at a few things, like it can read images really well, it can extract information from text really well, but there's all this other data in a patient chart, like medications, procedures, lab results, that they don't handle well. And so what you can do is focus on a small, narrow problem and do it really well, but if you try to get broader, it gets inaccurate and it just doesn't work. So a new approach is needed, and that's what we've done. We've been able to build it. So we were able to do it because we're a spinoff of Taipei Medical University, and in Taiwan, they have a really amazing national health data exchange. And then, of course, we got access to the Mayo Clinic platform. So with all of this data, we're able to build a network analysis where we understand for every diagnosis across every specialty, what are the typical medications, what are the typical lab results, et cetera. And we use this to build decision support that we give directly to physicians. So shout out to Jamie and everybody in the Accelerate team, because it's because of them we were able to build such a great product using the Mayo Clinic platform data. So our biggest use case that physicians seem to love the most is we help them in completing problem lists. And this is because it's a huge pain point. If they don't get it right the first time, clinical documentation improvement teams bother them. And so our product that does this is called DX Prime. And this is just one little example of a patient who comes in with stage 4 chronic kidney disease. And this is something a physician would have to review the patient chart to notice. Maybe the last time they saw this patient, it was stage 1. But this is a valid CC. So if they don't get it right, they're going to get bothered. They're going to have to waste a lot of time. Maybe the hospital will even lose out on revenue if it goes all the way through the cycle. So this is just an example of one small diagnosis we can help with. And how we do it is we provide a sidebar application. So they launch it when they're like completing progression notes or discharge summary, or maybe even during an admission. And it has DRG logic, so it can combine ICD codes to make sure the primary diagnosis is compliant. And it also finds everything else. So things that are revenue relevant, things that are patient safety relevant, everything you try to find when you're doing concurrent coding, but right away from the physician without any outside assistance. And it really does work. When we deploy it, we see that about 78% of patient cases have one diagnosis added from our suggestions by the physician. And overall, it's 15% of the valid CCs and MCCs and 35% of the comorbidity index diagnoses that are added to the patient chart come from our suggestions. So the physicians love it and they use it to save time. It makes things easier for them. And administrators love it, of course, because they have less administrative costs and they get more accurate billing. And so we've deployed it so far in 17 hospitals in Taiwan and China. We have about 6,000 physician users. Our biggest hospital is actually in China with about 5,000 beds. That's kind of crazy, but it's been a really fun project. And we're really trying to come to the US right now. And so we've been FDA cleared. We've validated our model with Harvard, and we're working with them on their famous Safe Care project on patient safety. So they're using our AI to just automate chart reviews so they can find medical errors in retrospectively from Mass General Brigham hospital data. And of course, we're looking to work further with Mayo, and we're trying to get into MCP deploy, but not signed yet, but that's our big dream. And I just want to mention really quickly, patient safety is really important as well. I talked about things that impact billing, but we also have solutions that identify wrong drug errors. One of the hospitals in China where we deployed, just before we started talking to them, they had a patient with hypotension that died because nobody noticed it, and it was in the chart for more than 8 hours, and our product could have flagged it, So let's work together on this and, make everything better for everybody, physicians, administrators, especially patients, of course. And thank you very much. Contact us if you'd like a demo. My name is Jeremiah. I'm the Chief Product Officer. And man, we love Mayo. We love this conference, all of you wonderful people. Thank you so much.